across our state turned out to make their voices heard and to cast their ballots. I want to thank the election officials, especially the clerks, the staff, poll workers, National Guard members, and volunteers for all their good work to ensure Wisconsin had a safe and secure election. Clerks and election workers across our country are continuing to do their important work to ensure every vote is counted and every voice is heard. Here in Wisconsin, election officials are doing their due diligence to ensure Wisconsin has a fair and accurate count and are working through the steps of Wisconsin's certification process. This includes triple checking results and auditing voting equipment. This is normal, and it is important for everyone to remember to be kind, be patient, and to know that this isn't a sign of a problem, but rather that every single vote is being counted and every single voter is being heard. That's democracy done right. Because an election doesn't end when an elected official says they won, it ends when every vote has been counted. Thank you to our clerks, election administrators, poll workers, and other volunteers for all their good work getting this done. This sort of commitment to the common good makes our democracy and our state better. And that's exactly what we need, perhaps now more than ever, a commitment to the common good. Whether that's taking precautions when you're out running essential errands, to keeping others healthy, picking up groceries for a neighbor who might be at higher risk for the virus, or staying home altogether. It's Wisconsin's empathy and compassion that will get us through. And nobody knows that better than the folks working in nonprofit organizations in Wisconsin who have been there every single step of the way throughout this pandemic, answering the call to serve by providing critical and diverse services to Wisconsinites facing significant challenges. That's why yesterday we announced a $10 million grant program funded by federal CARES dollars for organizations that are providing services such as healthcare, housing, shelter, adult education, or other critical services to individuals in the midst of the COVID-19 pandemic. Every Wisconsin worker, student, and family has been impacted by the pandemic in nearly every aspect of their lives. And the economic stability of our nonprofits is key to ensuring that they can continue their good work for people across Wisconsin as the pandemic continues to impact every community. And folks, it is affecting every Wisconsin community. We have statewide community spread. Yesterday was a record-setting day for Wisconsin with 5,771 people testing positive for COVID-19. It's not happening someplace else or to somebody else. It's here, and Wisconsinites in every corner of our state know firsthand the tragedies this virus and this pandemic hold. 71 of Wisconsin's 72 counties have had at least one death from COVID-19, and over the weekend we surpassed 2,000 deaths, with 2,102 deaths as of yesterday. Our hearts and condolences go out to the families across our state who are struggling with the loss of a loved one. We need to not only get back to the basics of fighting this virus, but get back to our shared Wisconsin values. Helping out our neighbors, empathy, compassion, and yes, doing things not because they are easy, but because they are the best for the common good. On Friday, Mayo Clinic Health System urged everyone to take precautions to help stop the healthcare system from being overwhelmed. Dr. Helmers, the regional vice president for Mayo, said, quote, "We are pleading with community members to comply with all recommended precautionary measures to help reduce transmission of the virus among our neighbors, friends, and healthcare workers. We can do this, but we have to do it together," end quote. Obviously, Dr. Helmers is right. We can turn the corner, we can flatten the curve, but we have to do it now, and we have to do it together. So wear a mask, stay home as much as you're able, avoid gatherings of folks outside of your household, and take every precaution to prevent yourself and your loved ones from getting and spreading COVID-19. With that, I will now turn things over to Secretary Designee Andrea Palm for her update. Andrea?
Thanks, Governor. Good afternoon, everyone, and thanks for joining us today. Since yesterday, we added 5,935 confirmed cases of COVID-19 to our total. Our 7-day average of new cases is 4,839. 1 month ago, that average was 2,400. 2 months ago, it was 767. That's an increase of 531% in just 8 weeks. Today, our total number of confirmed cases stands at 244,002. All 72 of our counties in Wisconsin are at a very high COVID activity level. That is a stark statistic all by itself, but let me explain it further, because even that number isn't enough to paint the full picture of the crisis. To be considered very high, a county needs to reach the case burden threshold of 350 confirmed cases of COVID-19 for every 100,000 residents. And yet many of our counties have a case burden above 1,000 and even 2,000 cases per 100,000. This is what we mean when we say we are in a crisis in this state. In every region of Wisconsin, we have hospitals reporting staffing strain, as well as hospitals reporting that they are at peak census for accepting patients, for their hospital beds, and for their ICU beds. This means that hospitals are at or near capacity and that their options are limited when it comes to the need for more beds and for admissions. Our alternate care facility, our ultimate insurance policy, in the case of our system being overwhelmed, continues to accept new patients transferred from hospitals across the state. We have now lost 2,156 Wisconsinites to the virus. Friends and family, neighbors, coworkers across the state feel this loss, and we keep them in our thoughts. We need to do everything we can to stop the spread and to stop the loss. We need to join together as individuals who care about our communities to stop the spread of COVID-19. Wear a mask if you have to go out. Stay 6 feet apart. Wash your hands frequently. Get your flu shot. And if you need a test, get a test. Isolate if you test positive and call your close contacts to let them know to quarantine and that they should also get tested themselves. Remember, a negative test isn't a ticket to meet up with friends. It is a snapshot in time, and you need to continue to monitor for symptoms because the incubation time for this virus is up to 2 weeks. And stay home. We're all tired of this pandemic, and I know we've been saying it for months now, but we're saying it because it works. Stay home to save lives. It's the safest choice you can make for yourself, your family, your community, and the state of Wisconsin. Thank you.
Thank you, and we'll now take your questions. A reminder to maintain audio quality, to stay muted until it is time to ask your question. And a note today that we have a hard out at 2:15, so please only one question per reporter per outlet so we can accommodate as many of you as possible. And we'll begin this afternoon with Denise Lockwood from Racine County Eye. Denise?
Thanks for taking my call. What I want to understand is, Governor Evers, what would a nonpartisan policy look like as you work through a lot of the issues of not having the state legislature being part of the solution? What would that look like?
A nonpartisan policy? Yeah. Wear a mask. People, there's a majority of people in the state of Wisconsin, so it is already a nonpartisan policy. We're a bipartisan or multi-partisan state, so we're already there. So requiring everyone to have a face covering would be something that I think would be bipartisan in not only nature, but frankly, making sure that we get this done. We just have to get it done. And so wearing a mask, having a limit on public gatherings, I think the two things that we're working on now are excellent opportunities for a bipartisan support, because it already has it.
Thank you, Denise. Now to Katie Anderson from WBAY-TV in Green Bay. Katie.
Hi, thanks for taking my question. Just wondering what the governor's reaction is or thoughts on Donald Trump wanting to do a recount, and what's your advice for people while we wait even longer as that process goes through?
Well, there's not many times I have agreed with former Governor Walker, but when he said it's a high hurdle, the 20,000 votes, I agree. But it is something that is obviously legal, and people have the right to demand a recount. And if that happens, we will be patient. And we have great people at the Elections Commission that will supervise that process, as well as the people in our communities. And so that will play out. Just in passing, I know when Jill Stein requested it 4 years ago from the Green Party, it took 10 days. So it wasn't necessarily a burden to people. It certainly is a high hurdle, and I think an insurmountable hurdle. But what I think about it, that's not my business. If the Trump campaign wants to have a recall, they'll have a recall. They have that right. We'll get that done, and we'll move forward.
Thank you, Katie. Now to Stephanie Hoff from West Politics. Stephanie?
Good afternoon, and thanks for taking my call. Governor, I'm looking for your response to the election results. Biden was called for Wisconsin, and Republicans hold on to a majority in the state legislature.
Well, I'm happy, obviously, as a Democrat, that Joe Biden was elected to be the next president of the United States, or at least is on his way. So it was a good win for him in Wisconsin. We were able to make sure that Speaker Voss's goal to have a supermajority did not happen. So we were happy that we were able to prevent that from happening, and our ability to veto bad language or either bad district lines through redistricting or vetoing bad legislation still is within my purview. So all that's good, but it is reflective of, frankly, our state. Our state is and always has been in a very contested, bipartisan state. And so we work together to get what we can get accomplished.
Thank you, Stephanie. The next question belongs to David Wahlberg from the Wisconsin State Journal. David? And a reminder, *6 to unmute your phones. David Wahlberg from the State Journal. Okay, we have to move on then to Sophie Carson.
Sorry, that took a little while. I wanted to ask about contact tracing. Dane County a week or two ago officially said they're in crisis model of contact tracing. They aren't promising that they can interview each case or contact their close contacts. Is the state essentially, statewide, all counties, essentially at that model right now? And if so, is contact tracing even useful anymore?
Yeah, so there are certainly a number of counties who, and we have been in close contact with them and providing assistance and guidance on sort of this crisis level of contact tracing. I would ask Dr. Westgard if he wants to say in a little more detail those conversations and our work with them.
So I think the answer is many, probably most, but not all. You know, the goal of having every person who tests positive contacted and interviewed by local public health is very difficult to maintain when we have such high case levels. But there are some jurisdictions that are still keeping up. But the majority of them, like like Dane County, have been unable to keep up to meet that standard. So when we talk about a crisis standard of contact tracing, it means we have to prioritize or triage the investigations that we do to make sure that it gets the most benefit for those contacts. The second question of does it make any difference? My strong view is that the answer is yes. Contact tracing can save lives, even if it isn't successful at our overall goal, which is flattening the curve and eliminating transmission. When someone is notified through contact tracing that they were exposed to the virus, they can take that information and do very beneficial things, which is stay home, stay out of contact with people who are vulnerable. The thing we're trying to avoid through contact tracing is people becoming exposed to the virus without knowing it. And that's how we protect vulnerable people, is by identifying people who have been exposed and might therefore become infectious. So there'll never be a point where contact tracing doesn't have the potential to save lives. And right now we're trying to do the best we can under the circumstances and build for a future where we can use contact tracing to our primary goal, which is to actually reduce transmission on a measurable scale on the population level.
Thank you, David. Now to Sophie Carson from USA Today Network, Wisconsin. Sophie.
Hi, this question is for Governor Evers. My question is, how do you feel about your ability to work with Republicans in the legislature on COVID-19 after they expanded their majority in the Senate?
Well, yes, they did, but there's still a virus out there. It's still killing people at record rates, and we don't. I can't believe that whether they increase their majority or not, that they're in favor of doing nothing. And so I welcome, of course, Majority Leader Fitzgerald will still be around for a while. So if he's got some ideas, bring them on. If whoever replaces him has some ideas, bring it on. We just can't do nothing. That's the bottom line. As a state, if we just let this run rampant for months, we will lose lives, and there's just absolutely no reason why we can't get it done.
Thank you, Sophie. Now to Mason Dowling from WAOW-TV in Wausau. Mason?
Hi, I know it's only been a few days since Halloween, but I wanted to ask the DHS if they're tracking any potential COVID outbreaks or spreading from Halloween or related events.
Not that I'm aware of, Mason.
With the limitation that I just described, that many jurisdictions aren't able to do in-depth interviews with all cases, part of the contact investigation is saying with whom have you been in close contact and what gathering. So if someone attended a gathering associated with Halloween or was in close contact through that, we would pick it up that way, but not in a systematic way are we investigating Halloween specifically.
Thank you, Mason. Now to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thanks for holding this. The Wisconsin Supreme Court denied a request for a bypass in a capacity limits case. Can you talk about what your reaction is and when do you expect to hear from the appeals court? Thank you.
Sure. This is Ryan Elsastuin. As you indicated, the Wisconsin Supreme Court denied the bypass petition, so we'll be proceeding with having the case decided on the merits. We'll be going back down to the circuit court to do that. I'm sure there'll be an appeal then to the Court of Appeals and then the Wisconsin Supreme Court again. So while it didn't end up in the Supreme Court today or tomorrow, I'm very confident that we'll end up there in the not too distant future.
Thank you, Sean. Now to Todd Richmond from the Associated Press. Todd?
Hi, can you hear me? Yes. I guess this might be a question for the governor or for Ryan Nilsestein, but what would have been, I'm not even sure if you can comment on strategy here, but what is the point of asking the Supreme Court to take the capacity limits case directly when it's pretty clear you know how they're going to rule given the court's political leanings?
Sure, Todd, I can answer that. This is Ryan. I think it's easy to say, because 4 of the candidates are supported by conservatives or Republicans and 3 tend to be supported by Democrats or liberals, that's how they're going to rule on this. That said, I think you can look at some of the past decisions just this year, even ones that we lost, where some of the justices don't align like that. I think this is a new case. It has, when we first issued the order, the reason why we think we have a strong legal argument is that in the Legislature v. Palm decision, the Safer at Home decision, the court explicitly upheld the part of that order related to schools and under the statute, and that's the exact same authority that we're using here. So we're confident in our legal argument. The reason why we wanted to go to the Supreme Court is that we think it's important in the middle of a pandemic to have this be quickly resolved, because the longer that we're fighting about it in courts, the less time we have to implement measures that we know will save lives.
Thank you, Todd. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hello. The alternate care facility, as you guys have talked about, is able to accommodate patients who are already on their way to recovering from the virus. But you mentioned that hospitals continue to near capacity. Are you worried that you guys could run, or hospitals could run out of space and staffing for patients who are in the ICU? And if so, is there some kind of contingency plan that's in the works if that were to happen?
Yeah, that's a great question, and it is something that we are certainly paying attention to because you're right, there are different levels of care within the hospital system, within the region, and then with what the alternate care facility can accommodate as it relates to acuity. And it is, right, it is what the hospitals spent their time during Safer at Home thinking about and planning for, and it is what we are executing against now. We're pulling as many levers as we can, whether it's regulatory flexibilities that help us on the staffing shortage side or on the actual bed capacity side, whether it's looking at our staffing contracts that would allow us to facilitate both for the alternate care facility, but for hospitals more broadly, access to staffing should they need to take that route to plug holes in as it relates to staffing shortages, and other strategies where we're actually looking at beds particularly. It is why we purchased ventilators, to make sure that we would have equipment should our hospitals need it as it relates to some of their ICU needs, et cetera. So this is multi-layered, and it is critical, the work that the hospitals have been doing within their systems, across their systems, and for those who are systems that cross state lines, how they're thinking about that planning across those lines as well. But obviously what it speaks to more broadly is the need to reduce the new number of daily cases, and therefore the number of those new daily cases that will end up in the hospital and needing ICU care or ultimately maybe the alternate care facility. We have the power. This is in our hands, and we need to do everything we can to stop the spread, and that means stay home as much as possible. We should not be having contact with other human beings that we do not live with. Hard stop. That is where we are. That is the best tool that we have to stop the spread of this disease, and we all need to do it with vigilance. If we want to help our frontline healthcare workers and our hospital systems from getting to the place where their capacity cannot meet the demand that is put upon them for hospital care because of COVID and because of non-COVID, flu season, et cetera, the regular course of business that hospitals do. But we have the ability to do this, to turn the corner, to stop the spread, but it will require us all to stay home as much as possible and reduce our social contacts to people that we live with.
Thank you, Madeline. Now to Jessica Van Egren from Up North News. Jessica?
Yes, my questions had to do with the Supreme Court decision earlier today about the Tavern League lawsuit, and those have already been answered, so I'll pass. Thanks.
Okay, thank you, Jessica. Now to Ben Krumholtz from Fox 11 in Green Bay. Ben?
Hi, thank you for the time today. Governor Evers, any reason for optimism that the federal government will be able to come to an agreement on a new relief package now that the election is over?
I think that helps, to be honest with you. I think things were stalled. One of the reasons was because of the election. So, yes, I encourage people all across the state to contact their Congress people and encourage them to do that. That is absolutely critical. You know, we will have lots of expenditures to make after the first of the year, and including all the basics, testing, contact tracing, PPE, you name it. So yes, that is one barrier that has now been removed, and hopefully the Congress would work as quickly as possible on that.
Thank you, Ben. Now to Terry Sater from WISN TV in Milwaukee. Terry?
Good afternoon. My question is for the governor. In the latest White House coronavirus report, Governor, it calls for a more comprehensive mitigation strategy, saying that's what's needed. What is your response to that, Governor?
Yeah, well, I have it right here. I know you can't see it. I have it right here in front of me. And just to make the point that Secretary Paul made a few minutes ago, all you have to do is look at this sheet here, look what's red. And think about what that looked like a week ago. So it continues to be bad. And so we in the perfect world, we wouldn't be in court every month with every time we do an order. In a perfect world, we would have people complying voluntarily on things. We don't have a perfect world. And so whatever we can do to encourage our legislators to come to the table with some ideas, and we do need to require something here. And we have a public gathering order that has been kicked around in different courts, and every time it gets kicked around, it has its ability to make a difference goes away immediately because there is no requirement. We need to require things, and this is one of them. Public gatherings, obviously, wearing a mask, obviously, and there are other things. But in the meantime, as Secretary-designate Palm said, stay at home. Stay at home. Limit your interactions to people that you know, that you live with, and stay at home.
Thank you, Terry. Now to Megan Mamlock from WJFW TV in Rhinelander. Megan. Once again, Megan from WJFW TV. Okay, we're moving on then to Rob Sussman from WTIQ Radio in Green Bay. Rob?
Yeah, thanks for taking my question. I've asked this question before a number of times, but we're still seeing the numbers rising in Wisconsin. Seems like, on a several times a week basis now. The mitigation efforts that are underway here in the state of Wisconsin, are they doing anything whatsoever? This is something for the health crowd among the panel today, and where are these increases coming from primarily? Thank you.
So Rob, I'll say a couple things, and then Dr. Westergaard, I'm sure will want to pile on here as part of the health crowd, as you call us. So I think what we know from the science and the data is that masks work. To help stop the spread. They are a barrier for the transmission of respiratory droplets, which is how this virus spreads. But right, the more people that do it, the more effective that it is. We also know that reducing capacity limits in indoor spaces is a strategy that works. And I think fundamentally, when you look around the country, when you look at states who have seen surges throughout this pandemic, they have undertaken these mitigation strategies and others to slow the spread. We are doing what we can within the authorities that we have at the state level, but there is no state in the country who was seeing the kind of strain on their hospitals that we are seeing now that did not place requirements and take mitigation strategies through executive order, through public health orders to reduce the spread of this virus. And they are the common sense things that we are talking about. It's reductions in public gatherings, it is mask wearing, it is, and in many states went farther than we have the ability to do here in Wisconsin, but it is why we all need to do them really well, and we need to go above and beyond, and we need to make the cautious, safer choices to add to the value of the mitigation strategies that we are asking people to do already. But the bottom line is the more people stay home, the more people limit their human contact only to those that they live with, the sooner we will start to see this virus recede, and we will start to see our daily numbers go down and subsequently our hospitalizations and deaths go down. But the strategies are the same, and we just really need to start doing them like yesterday.
I don't have much to add other than to say I think it is an important and a good question. What we know from modeling studies and observed data, so from epidemiology studies, is the virus can move so quickly. Like early in the pandemic, there were communities that had a doubling time of 3 to 5 days, exponential growth. So we know that it can move that fastly and infect an entire population if left unchecked. So we are seeing high rates of transmission and an acceleration, but we're not seeing exponential growth. And that means we're doing something to slow it down. So I think the short answer is yes, it could be worse. All the things we're doing have kept it in check, but we're just not doing them well enough. We're not doing them aggressively enough. And the strategies are there, the evidence is there, but it's going to take a lot more than we're doing to slow it down to a level where we're going to feel comfortable that we're not at risk for many preventable deaths.
Thank you, Rob. Now to Danny Maxwell from WKOW-TV in Madison. Danny?
Hi, yeah. So I have another question for the governor about the election. In the Trump campaign statement about the recount, they said there have been reports of irregularities in several Wisconsin counties. What is your reaction to those accusations that the election has been fraudulent, and what irregularities may they be talking about?
That is beyond irresponsible talk, but frankly not unexpected talk, considering the source. Our elected elections officials work so goddamn hard, and for the President of the United States, without any data to support him, to talk in that way about our elections officials and our clerks and our volunteers and our National Guard. We had a great, and I'm not talking about the outcome, we had a smooth election under extremely difficult conditions, such as a pandemic. And for the campaign to say those types of things, it's just more of the same BS, frankly. Real tired of it. You have an opportunity for a recall. It's well within your rights to do that, or recount. So do it. Get that recount done so we can move on with our lives.
Thank you, Danny. Now to Eric Gunn from Wisconsin Examiner. Eric.
Hi, this is Melanie Conklin, sitting in for Eric. My question has to do, is for you, Governor, and it has to do with, I'd like to hear your post-election thoughts on any possible changes you anticipate for the next legislative session in the wake of the election, and also if you see that there might be any differences in your working relationship with both houses, both the Assembly and Senate?
Well, the makeup's pretty much the same. I know we were able to prevent a supermajority, which I think is beneficial for all Wisconsinites to make sure that it's not one-party rule. But that said, I'm always open to having conversations with Republicans on any sorts of issues. I know they believe, but maybe on a different level, in the things that I care about, and that's around healthcare and education and roads and other infrastructure. Those are all issues that, when I was elected, that the people of Wisconsin indicated they wanted. So I don't think it's going to change the dynamics much, but the issue is about the same. And when we go into the making next biennial budget, we'll have great conversations about those items that I mentioned and others, and we'll come to some conclusion at some point in time. We'll work together as best we can.
Thank you, Melanie. Now to Adriana Mendez from TMJ4 in Milwaukee. Adriana? Adriana Mendez? And a reminder, *6 to unmute your phones. And once more, Adriana Mendez from TMJ4. Okay. We'll move on and see if we can come back to Adriana. We'll move on to Will Cushman from Wiscontext. Will?
Hi there. I think this question would be for Secretary-designate Palm. You mentioned that hospitals in every region around the state are continuing to deal with staffing shortages. I'm wondering if those shortages are being felt more acutely in certain regions and where that might be. And I'm also wondering if the loosening restrictions on out-of-state healthcare workers being able to work in state, if you're aware of that being able or having the effect of helping relieve any shortages anywhere in the state. Thank you.
Thanks, Will. So we certainly are hearing about staffing shortages, and right, they, like all of this, because hospitals are so dynamic and they're just in time, real time, monitors and navigating who's coming in, who's going out, and the staffing necessary to accommodate that very dynamic scenario in which you don't know from day to day what's going to pull up in front of the hospital necessarily. So the shortages ebb and flow similarly. It is why the deployment of rapid antigen tests is a helpful strategy as they try to manage their staffing shortages. And so it changes day to day and hour to hour, and we certainly have used a number of our both regulatory flexibilities as well as called on our federal partners to help us mitigate some of those staffing shortages when they were more chronic and going to be a little bit longer term, and it needed an asset that could be around for a couple of weeks or a month. So we're pulling all the levers. We're in close contact with the hospitals, but it is the kind of dynamic thing that changes daily and hourly for these hospitals as they very actively manage their caseloads. I would say probably the western part of the state are seeing at this point the least burden on staffing as it relates to current shortages. But again, as we see the daily number of cases climb, as we see hospitalizations rise, we certainly are at risk across the state for shortages, and folks are going to need to be prepared all around, which is the work that hospitals have been doing to get ready for this. They also, many of them have their own staffing agencies and other strategies that they're deploying. But it certainly is an issue, and as with all of this stuff, speaks to our need to do everything we can to stop the spread and stop the ultimate need for hospitalizations for more and more Wisconsinites.
Thank you, Will. And we have time for one more question, and that belongs to Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
All right, thank you. This question is for Dr. Westergaard. I have a quote from the medical officer for health out of Ottawa, Canada. She said, I have written to the mayor describing the need for a new approach to the pandemic response for the sake of the population's health. We need to be learning to live with COVID, to coexist with COVID with caution. What is your response to that quote, and do you see yourself ever giving Governor Evers the same advice?
Well, we have no choice but to live with COVID. I would say that our goal on top of that is to prevent as many people of dying from COVID as we possibly can. And I think that the scientific evidence has shown us a number of ways to do that. The strategy that we've developed at DHS is to try to do all of those things as much as we can. So yes, we want to live and we want to thrive, we want to be resilient despite the fact that we're living through a pandemic, but that doesn't mean that we should let up and from being aggressive on the social distancing and the mask wearing and the limiting gatherings that we do. So I don't know the full context of the quote to be able to respond to it any more than that. But yes, we need to live with COVID. We also need to try to drive the transmission of COVID into the ground so we can live, hopefully, without very much COVID in our communities. And I think we have a strategy to do that. We just need to pull it off. We need to work harder. We need to do it more aggressively to prevent transmission.
Jonathan, and that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon.